I'm Dr. Andrew Bang. I'm a chiropractor at the Cleveland Clinic. What is sciatica? Well, we have 5 lumbar nerves, and those 5 nerves come together into one big nerve called the sciatic nerve. When any of the 5 lumbar nerves are irritated, that is sciatic pain. What are some of the most common symptoms of sciatica? First, you're probably going to feel pain shooting down one leg into your foot. It could be accompanied with things such as numbness, tingling, shooting, burning pain. Even you can experience that. Depending on the severity of your sciatica, it can limit a few or a lot of your activities of daily living. When it's mild, you'll still be able to do most things, but it will hurt to maybe lift over your head or reach down to tie your shoes. When the pain gets severe, it can even cause muscle weakness. So then it can be difficult to walk, difficult to bend and pick something up from the floor or stand in one position for a long period of time. When should you seek help? A lot of patients ask me, can I do this on my own? Do I need to see my doctor or chiropractor or physical therapist, or should I go to the ER? Oftentimes I tell my patients to give me a grade of their pain, and I use a 0 to 10 scale. A 0 out of 10 is no pain at all. A 5 out of 10 is moderate pain, and you might be experiencing a few disruptions in your activities of daily living. When a patient tells me that their symptoms are 10 out of 10, almost all of their activities of daily living are affected. They find it even difficult to sleep. When your symptoms are between the 5 and the 10 out of 10, that is the time you really need to see a physician, chiropractor, or physical therapist. If the pain's super severe, you really need to go to the ER if you can't do anything. In very rare cases, your sciatic symptoms may actually be something else. When you start to experience pain down both legs, you need to go to the ER right away or call 911 to have them take you to the ER. What can you do for relief? The first thing I would do is schedule an appointment with your medical doctor, chiropractor, or other provider you'd like to see, just in case these home tips don't work. After 72 hours of trying them and you're still in pain, that's when you need to go see the provider. And there is 3 really amazing stretches that you can do that help most people that experience sciatic pain. The piriformis stretch, the runner's lunge, and the cobra stretch. Try all 3, pick the one that feels relieving to your symptoms, and use it a lot. You should be spending 1 to 2 minutes doing that stretch 5 to 6 times a day. Another easy thing you can do to treat your sciatic symptoms is use over-the-counter pain medication or topicals, such as lidocaine patches and other things you can get in your drugstore. And even ice is a wonderful therapy to use with mild sciatic symptoms. There's a high likelihood that each of us are going to experience sciatic symptoms sometime in our life. And when you do, first do what you can at home. Stretch, avoid those positions that make it worse, use ice, use over-the-counter medication, easy stuff. But if it's not helping within 72 hours, make that appointment with a physician, chiropractor, physical therapist, or other provider so that it doesn't become a long-lasting severe case of sciatica.